to another episode of Longevanity, where we explore all those things related to health, wellness, and quality of life. I'm just waiting for all my streams to connect here so that we're good to get started. And it looks like we are now live. All right, so let me just minimize that window and I'll take my glasses off. I can't see anything without these guys on, but it looks like we're good to go now. So thank you for joining us today. My name is Amber Bocknek. I'm a physician up here in Ontario, Canada, where I have a practice that is involved with health, wellness, longevity, and that means sort of looking good and feeling good from the inside out. And we like to explore a lot of topics that are directly related to, again, just sort of living your best life and whatever that may mean to you. So today's topic we want to focus on is pelvic floor health for men and for women. So before we dive right in, I just need to start every episode just by reminding everybody that this is really for educational purposes only. The content we talk about here is to empower you and fill you with things to go back to your own care providers with, to ask really meaningful questions and get the answers you so rightly deserve. Again, here on the podcast, we can't actually diagnose, treat, prevent, or cure any disease, but hopefully we'll give you some tools to get you in front of your care provider and get things moving forward. So with that said, welcome, and let's talk a little bit about it. So pelvic health issues, why is that a topic of a conversation today? Well, this is a widespread, pervasive issue that affects both men and women. In our practice, we have, as part of the longevity practice, we have a hormone management program, again, for men and women, as well as full longevity. And I can definitely give you the stats on women. Women have a very abrupt drop in hormone status as they hit perimenopause and full-on menopause. And that really takes sort of a slowly progressive problem and accelerates it. And we see a lot of change in pelvic health in and around the perimenopause and the menopause. And with the guys, we see it as well too, as they lose testosterone, but also just in general as we all get older. So let's talk a little bit about anatomy first. So the pelvic region is actually a dynamic area that is made up of hard structures, the bone. So the pelvis is actually a bony halo. There's muscles that make the bottom of it to make it bowl shaped, but it's a bony halo with a bottom constructed of multiple muscles that have a lot to do with control of some of the organs that sit down there that give support and again help a fair bit with balance. So just in general, really everything falls under the use it or lose it principle. And as we keep progressing through life, unless we're really working on things to try to help our pelvic floor strength, it does in general just kind of decline a little bit. So we do get a little bit of regression in our bone all over our body. You know, that's why your aunties or your mom or your grandma got a little shorter later in life as bone reabsorption happens in their spine. Well, this happens all over the body. In my facial aesthetics part of my practice, sort of my outside anti-aging part of the practice, we see it again because we lose bone structure in our face, our orbits get bigger, making our eyes more sunken, our cheekbones slowly regress, making the cheeks flatter, and then the skin hangs down, we get some jowling, we lose jaw contour. So this is happening there, but it's also happening everywhere else. Our femurs, again, the main thigh bone is getting weaker and thinner. The bones in the pelvis are also becoming weaker and thinner. And the other thing that's happening is the musculature is, and these things all interact together. It's a very dynamic process. And so for women with the physical changes that happen in natural or vaginal childbirth, it's like pushing a little football through a garden hose. That makes a few changes down there. And if you had a fairly big baby and a fairly little pelvis, if you were assisted with a vacuum or a forceps or a episiotomy, you may also have some trauma damage as well down there contributing to everything. And in general, even for women who didn't carry pregnancies or had C-sections, or for guys, everything there becomes a little atrophic or thins out and becomes a little weaker. And this has some far-reaching effects on pelvic health and organ health. So the different systems that pass through there, well, the obvious ones are the bladder-related functions and the bowel-related functions. They all pierce through that little bit of musculature there to exit. And we can have difficulties with urination. You can also have difficulties with stool control. So, again, a weaker or poorly functioning pelvic floor can contribute to that. Also, sometimes, again, if you think of it as a bony halo with the bottom like a little trampoline of muscle, if our trampoline is really weak, think of it as a saggy trampoline. That is supposed to keep those inside contents up on the inside, so your bowel, your bladder. And so sometimes those things will start to descend down into less optimal positions lower in the pelvis. And that makes our muscle system, the little sphincter muscles that are there to control the outlet of stool or urine, it gives them a much harder time if things aren't sitting at the right angles. That those principles of physics, they're there whether we like them or not, for the good or for the bad. And so sometimes if our little trampoline of muscles is getting weak, things aren't sitting where they ideally were intended to sit, and that interferes with some of our circulation, some of the muscle control, that again interferes with our bowel or bladder control. Other things that can happen when things drop, sometimes it can interfere with our ability even to move our bowels. There are relationships between constipation and pelvic floor dysfunction. So, having a healthy pelvic floor and pelvic floor positioning helps us to be able to pass stool properly and on a more regular basis. There's also a relationship actually between the ability to pass stool and to urinate. It is not uncommon that if somebody really struggles with significant constipation, that they may actually have issues with bladder function as well. And that can manifest in a couple of different ways. So sometimes they feel like they have to pee all the time, and sometimes they have difficulty peeing. So why is that? Well, I want you to imagine this little bowl, this bony basin of the pelvis, the bony halo, again, like a little bowl with a fixed amount of space with the muscles at the bottom. And if that little basin has a colon full of hard stool in there, rock hard, it's taking up, there's a limit to how much is inside this little bowl. So if the bowl is full with the colon coming down full of stool, it puts pressure and it compresses the bladder. And so sometimes that means there's not a lot of space for that bladder to fill. So sometimes constipation, actually can make you feel like you have to run to the toilet to pee very small quantities all the time. It doesn't necessarily mean you have a bladder infection. We have to consider that as a possibility and exclude that. But sometimes if you have this sense of urgency, this sense to have to go all the time, one of the other questions besides looking out for bladder infections or irritable muscle of the bladder itself is to look at, well, what's your bowel habit? Because again, that can fill up the space and there's not a lot of filling room for the bladder, and then you have to keep emptying it. Also, on the same token, if the bowel is chock full of rock hard stool, it can make it very hard to pass your urine, because again, it may be pushing on the outlet part of the bladder, making it hard to pee past that, which again is kind of like what the guys experience if they have a big bulky prostate. It can be hard to pee past the prostate, and it makes them have to go little amounts a lot more frequently when they get really full and they have a lot of pressure behind it. So either way, a bowel issue can sometimes have spillover impact on a bladder issue. And if you're having bladder issues, we have to really consider the interplay of them both. So these things have issue there. So again, a healthy pelvic floor can impact on both bowel and bladder function through some of these indirect mechanisms as far as how your bowel habit and other go. A healthy pelvic floor helps to keep those pelvic organs in the right place. There's something called prolapse, where some of these things start to descend. So earlier versions of prolapse can sometimes be assisted by treating and working with the pelvic floor. Later versions of prolapse, at that point, really most of those fall into the hands of the surgeons, where they have to go, hoist and resuspend some of those little bits that are kind of coming down where they're not supposed to be. So again, in the perfect world, we like to get on top of that a little bit easier. Pelvic floor muscles are also important with some of your overall sense of balance and stability. So again, important things, especially as we get older and we don't want to worry about falls and fractures. and just some of the changes that happen with aging as far as bony health go, sort of separate to the musculature. As our bones thin a little bit, if you have a history of osteoporosis or you yourself know you may do, again, falls can be more than just embarrassing. Falls can lead to hip fractures and pelvic fractures, which again can sometimes be life altering in some very severe circumstances. So again, anything we can do preventatively to keep ourselves as healthy and fit as possible is always a good thing. So what do we do about this? How do we help our pelvic area? So one of the things that is now becoming more and more popular are these chair treatments. I don't know if you've heard a lot about them, but they come under different brands. It's kind of like colas. There's different brands of cola, Coke and Pepsi, and the grocery store brand, and all sorts of them. But these chairs are what we call pulsed electromagnetic energy. And these chairs make a field of energy that makes your muscles contract. So we're able to do workouts, really tightening and contracting those pelvic floor muscles, which again can promote health and help prevent some of these problems. But it goes deeper than that. There's been more and more research on this pulsed electromagnetic energy and a lot of the other benefits it has. And we've seen this in bone healing. Actually, some of the first commercially available pulsed electromagnetic devices were in the world of fracture healing, so can be helpful for bone. We also see benefits, interestingly, in vasodilation or improvement in circulation. There is action of the pulsed electromagnetic energy that really does tend to help blood vessels dilate, and that tends to improve circulation to those areas. So in men's health, for example, we're using these chairs in addition or sometimes instead of some of the little blue pills that are out there to help them with erectile dysfunction, as well as overall pleasure and enjoyment and getting some of that sensation back. And for women as well, too, again, small blood vessels tend to be very delicate, and with just some of the things that happen as we go through life, we get hardening of our arteries everywhere. So again, some people think of coronary artery disease or heart disease or stroke as being where hardening of the arteries affects you. But hardening of the arteries happens in all those delicate little arteries all over your body. They're not just exclusive to heart or stroke. So in the genital area, we can have hardening of the arteries as well, the fine little delicate ones. Interestingly, men, if you're listening, or women, if you have men you love in your life, sometimes the very first manifestation of cardiovascular disease is erectile dysfunction. So every man who has new onset erectile dysfunction really should be seen by their primary care provider and have a careful consultation to go looking for risk factors for cardiovascular disease and be appropriately worked up. It's not just inconvenient or embarrassment. It is, or loss of pleasure. It really can be a life-threatening issue, not the loss of erection so much, but the significance of why that loss of erection. So again, depending on the man, he may feel that that's as bad as death itself, but really, all joking aside, it is one of those warning signs of possible impending cardiovascular risk. So again, for all the men in your life who you love, it is important that if they are starting to manifest these sorts of issues, you get them checked out. For women, pelvic floor health and pelvic circulation is very important as well. Sexual function for women is impacted by responsiveness, ability to lubricate, and again, the whole experience of intimacy. So having improved circulation in that department can often help with issues of changes in sexual responsiveness or pleasure if things are changing. Sometimes, again, that can be a manifestation of that. So this is an area where these chairs can be helpful. There are exploring other avenues with these, not just this energy source, but these chairs as well. Sometimes in areas of endometriosis or other, there have been improvements, or there are women out there who have unexplained chronic pelvic pain. I can think of, people in my life who we talk about these sort of things when we get together and who are struggling and have tried a lot of different things. And again, sometimes it's elusive or unclear where the source of pelvic pain is. But after a careful and thorough review with their primary care doctor, exams and tests that all come back, the pain still persists. Sometimes the pulsed electromagnetic energy can be helpful in these chairs. So it's something to explore as a possible option to try to address this. Now, this is not unique to pelvic health. We've also been using pulsed electromagnetic energy in many different arenas for chronic pain problems. So sometimes it's helpful for some degrees of neuropathic pain and other muscular pain, but we do find it quite helpful. There may be some of you out there who have tried chairs before with limited success. And I would say to you again, if you've tried and struggled, maybe we look at perhaps trying again with a different type of chair. So not all of these chairs have the same amount of power. And sometimes that's a key factor. So let me give you an analogy. I love analogies. Tylenol as a medication. I think pretty much almost everybody has taken Tylenol at some point in their life. Tylenol comes in many different doses. If you've ever had kids or you've looked after little kids, like little wee ones, you can get Tylenol in a liquid form. And in order to be dose accurate, you take a syringe, you draw up a teeny tiny little bit, and you administer it. So think of dose related to function. If you took the dose of Tylenol appropriate for maybe a 20-pound 1-year-old, and you gave it to a 150 to 200-pound adult, do you think that that would be as effective? Most of us would say probably not. And so this is where the story of some of these chairs come in. There are different ones that are out there. Some of them have much lower power than other ones. So sometimes people who have been treated on a lower power chair are frustrated because they just feel like they didn't get anywhere with it. So this is where I would say to you, you need to, again, maybe re-explore other options. There are more chairs out there now than what we had previously. And there is a wide range of power in these chairs. So one of the more common older technology chairs, and I can tell you this from our own office experience, we've had two different ones. Our first one was a 3 Tesla chair. So interesting, magnets like MRI machines in these chairs are measured in terms of Tesla. So we had one of the more well-known older tech that was a 3 Tesla chair. The one we have now in our office goes up to 8 Tesla as appropriate. And again, power, if you think like Tylenol dose and effect based on size and all of these other things really are important. Well, the same principles hold true with some of these chairs. Dose and power that is able to be emitted can affect the depth of penetration and the broad base of penetration. So some of these other chairs that have been around a little longer, that are a little more known, with their lower power levels that only go up to 3 Tesla, they really have smaller focal points and are more appropriate for sexual health issues primarily. They tend to target just sort of the vaginal area or the more superficial parts of pelvic health, where some of the more highly powered chairs with larger magnets are able to affect a broader base and be able to create more effective outcomes for patients. So having said that, every person is different out there. And if you go back to my Tylenol analogy, there are some people out there who just say, Tylenol doesn't work for me, even at 2 extra strength Tylenol. So again, the same holds true with every type of treatment, whether it's a pharmaceutical or some of these different devices. It does not work for everyone, but definitely dose matters. Number of treatments matter. So if you're discouraged and you've struggled with this and you really find that nothing is working for you, one thing to do is just to investigate a little bit and just see what you were treated on before and maybe explore some other options. There may still be some hope for you to get the benefit and the care that you need and get the relief that you so desperately want. So if you've ever struggled, again, please reach out to me and we can take a look. I'm fairly familiar with some of the other brands that are out there, and I can give you a little bit of information about what you were treated on, or just go ahead and sometimes ask ChatGPT or some of the other AIs as far as what kind of power these devices emit and what they've actually looked at with them. in our office, we've done some studies. Initially, we did a head-to-head with one of the older technologies and the one we're with right now, where we looked initially just at stress urinary incontinence, something that affects many, many women. And we have an upcoming study coming along looking at endometriosis pain to try to help with some of these painful problems, because another big issue, of course, is pain. So stay tuned. That'll be coming up. We'll be launching that study shortly. But that is really where we want to talk about here today. So pelvic health is whole body health. Pelvic health can sometimes give indications to cardiovascular disease and other. We take pelvic health seriously. So for you out there, again, I hope you've enjoyed today's episode. If you like this type of content, and if you have topics or things you want to talk about, I would love to hear from you. So again, you can always message us or visit us on our socials. I'd be very happy to see you there. And please send me your questions, because I'll take those questions and we'll use that as a podcast topic. Also, please, if you like, please subscribe. Just scan this little QR code and join our Longevanity Watchers group. And again, feel free to visit our website, where we also keep lots of information posted. So to conclude today, thank you again for watching. Just remember, again, this is not intended to be direct medical advice, but more health education to help you get the information you so rightly deserve. Thanks again for watching, and I look forward to seeing you on our next visit together.